I'm Wendy Jacobs, Chair of the Durham County Board of Commissioners, and I'm here today to speak to our community about Durham County's response to COVID-19 and the county-wide stay-at-home order that I have just signed today and that will go into effect tomorrow, Sunday, March 29th at 5 p.m. This order is largely an extension of the city's order that went into effect on March 26th, I think, at 6 p.m. This order makes just a few revisions to that order, and it extends it to the entire county, including RTP, Treyburn Corporate Park, and the unincorporated areas of Durham County. We have worked very closely with the city on this order. The mayor, Steve Schewel, has consented to the changes that are in the Durham County stay-at-home order. So this order will be in effect for all of Durham County, including the incorporated areas of the city. I first want to say thank you to Governor Cooper for announcing a statewide stay-at-home order yesterday that will go into effect on Monday, March 30th at 5 p.m. Although we are 100 individual counties, we are one state, and we must address this crisis in a coordinated and comprehensive way. What happens in one county does impact another. We know that we have limited health resources, and as NCDHS Secretary Mandy Cohn stated yesterday, it is critical that we do all we can to contain the spread of the virus so we do not overwhelm our health system, to ensure critical care will be available to those who need it most. That is why it is so important that we fight this together as one community and one state. And I want to explain, as I continue my comments, that you will hear me cough. I have been in self-quarantine for about 2 weeks now. I did have a COVID test, which came back negative, and it looks like my cough is related to allergies, which is very fortunate. So the wonderful pollen that we see out about us this spring, this is one of the negative side effects for me and for other people. So I just want to qualify that when you hear me coughing, that I have followed all of the recommendations about self-quarantining, and I did have a telemedicine appointment and a COVID test, which I did find out a few days ago was negative. So I want to say to our community that yes, we are all facing a stark reality together, and as we live in unprecedented times. Today, there are now 621,096 coronavirus cases in the world, more than 500 million people, and 28,661 people have died. On Thursday, the United States became the country leading the world in cases. We now have 105,019 people who are known to have been infected with coronavirus, with 1,717 deaths. We have more cases now in the United States than China, Italy, or any other country. As the third most populated country in the world, we have a vast pool of people who can become infected, potentially. Here in North Carolina today, we have 763 positive cases of coronavirus, and I think it's 4, it may be actually we're up to 5 people who have died from this virus here in North Carolina. About a week ago, on March 20th, we had 188 cases, and a week before that, on March 13th, we had 19 cases in North Carolina. Here in Durham County, we are now up to 103 cases as of yesterday, with at least 7 confirmed cases of community transmission, which means we cannot identify exactly how the person became infected, and this is evidence that the virus is spreading in our community. About a week ago, on March 20th, there were 39 positive cases of coronavirus in Durham County. I share all these numbers to say that they are all telling us the same story, which is the virus is spreading rapidly, and we must do all we can to contain the spread of the virus. But the good news is that we know what we need to do, and that is to stay at home and to practice safe sanitation practices so that we can stop the virus from spreading from one person to another. The good news is that we have seen this strategy work in our country and in other parts of the world, and we know that when people practice staying at home and practice safe hygiene, that we see the number of cases decline and diminish. And we see that people who are identified as being sick, isolating themselves from people in their own households, and then others can get the care that they need. The Durham County stay-at-home order strongly emphasizes this. And this is really the heart of the Durham County-wide stay-at-home order, which is social distancing and safe sanitation and hygiene practices. I want to go over the county-wide order and focus on how it builds upon the city's order. Again, I want to be clear that this order is largely just an extension of the order that Mayor Schewel implemented on Thursday, March 26th. And the only reason that the city and the county did not move forward together at that time was because the Durham County Board of Commissioners needed to make revisions to our Durham County Emergency Ordinance, which we took action on yesterday during a special meeting. So these are the main points that are in now the Durham County-wide stay-at-home order. I'm going to go over very clearly what are the main differences and modifications and revisions. So number 1, the Durham County stay-at-home order extends to the geographic limits of Durham County and by consent of the mayor within the corporate limits of the City of Durham. Number 2, I want to encourage everyone to read this order very carefully. A careful reading will hopefully answer most questions that people have. We have included a link to the March 19th, 2020 CISA list. This is the Cybersecurity and Infrastructure Security Agency list issued by the federal government that gives very clear guidelines about protected activities and workers. We have also included a printout of this 11-page document, which gives very detailed guidance to all of our businesses. This should give adequate guidance to all of our research and manufacturing companies and other businesses that are located in RTP and the Trayburn Corporate Park. Again, I encourage all of our businesses to please look at this list very carefully, because this should answer many of your questions. Number 3, I encourage everyone to pay close attention to provision D on social distancing and sanitation requirements. I believe this provision is what is most important and is really at the heart of the stay-at-home order. We have strengthened the original provision D to include sanitation requirements in addition to social distancing. And I will read each part of this provision. A, social distancing and sanitation requirements. Any person who needs to leave their place of residence and all businesses permitted to remain open shall at all times reasonably comply with the following practices and require compliance by their employees, patrons, and visitors. For purpose of this proclamation, social distancing and sanitation practices will include, to the extent possible, number 1, employers shall perform temperature checks on their employees when they report to work and send home anyone with a temperature above 100.4 degrees Fahrenheit. Number 2, maintaining at least 6 feet social distancing from other individuals. Number 3, washing hands with soap and water, especially if hands are soiled, for at least 20 seconds as frequently as possible, or using hand sanitizer. Covering coughs or sneezes into sleeve, elbow, or tissue, not hands. Regularly cleaning high-touch surfaces. Number 6, not permitting the sharing of tools, instruments, or other devices in workspaces and recreational activities unless they have been cleaned in between users. And number 7, no shaking hands. So I want to emphasize that all aspects of the Durham county-wide stay-in-place order reflect and connect back and reference this section D. So whatever activity that you are engaged with, whether it's going to the grocery store, whether you are one of the protected businesses and you are going to work each day, whether you're a construction worker, whether you are a realtor, whether you are going out to play golf, which is allowed, or tennis, it is really important that you, first of all, the provision about cleaning equipment and instruments and tools, please follow those. We are also asking that if you have thermometers, to please try to implement this practice of temperature checks. We have seen this be a very effective practice in other parts of the world and other places in the United States. While we do not have the ability to do mass testing, but checking temperatures has proven to be an effective strategy. And I will tell you that Durham County government is implementing temperature checks right now. We have 4 infrared thermometers, and outside of our Health and Human Services building and also in the detention center, we are doing daily temperature screening of all employees and all residents, detainees, everybody, to check for temperatures. We have infrared thermometers that are on order, and when these arrive, we will be strategically deploying these into the community as well. I know that Durham City government is asking, for instance, their sanitation workers to bring their own digital thermometers and also do their own daily temperature checks. So again, this is something that we can all do, that we can all participate in any way that we can. And because I've been looking at that bright light now, I have been temporarily blinded and unable to read my comments. So again, I hope that everybody will really look at Section D on social distancing and sanitation practices. At the end of the day, for the county's stay-at-home order and for the governor's statewide order, it really boils down to personal responsibility and also just the responsibility of all of our employers. It's really up to all of us. And I still cannot read my paper here. Okay, the second areas of revision are that I want to emphasize, and I'm going to try not to look at the light now, is provision E on limitations on business operations, section R, professional services, and section In provision E, limitations on business operations, I'd like to draw attention to section R, professional services, and section S, childcare facilities. We know that this stay-at-home order will be revised over time as we better understand the needs of our community and changing conditions. In section R, related to real estate services, there is a parenthesis that has been added, which says, quote, "These activities may only be conducted by a single individual and are restricted to the following activities connected with closings, I, post-offer inspections, double I, appraisals, triple I, surveys, IV, final walkthroughs, and V, title searches. In-person showings and open houses are prohibited." These revisions were added in response to information provided by the real estate community that in addition to title searches and appraisals, inspection surveys and final walkthroughs are vital activities to finalize closings already in process, and they can be safely conducted by one person. I want to emphasize that we encourage our realtor community to take advantage of opportunities for virtual or Facebook Live events for showing of all properties. In section S, childcare facilities, we have added further guidelines for the safety of operations. And this section reads, "For specific employees exempted by this order, as well as child care facilities by this order, as well as," I may have written this down, I'm sorry, "as well as child care facilities providing services that enable first responders, healthcare workers, public health, health and human services staff, and others responding to COVID-19. To the extent possible, child care facilities must operate under the following conditions. I, child care must be carried out in stable groups." Stable means that the same person with children and staff are in the same group each day. Children shall not change one group to another. If more than one group of children is cared for at one facility, each group shall be in a separate room. Groups shall not mix with each other, and child care providers shall remain solely with one group of children. These are the only significant differences, again, with the order that was implemented by the mayor on Thursday. Again, it is just a strengthening of social distancing and sanitation and hygiene practices that we're requesting of everyone in our community. Number two, allowances for some additional activities that can be conducted by the realtors. And number three, just a strengthening of some of the guidelines for child care facilities. And also, we are adding the link and the list, the CISA list, to help with communication purposes. I know that this county stay-at-home order, excuse me, I know that this county stay-at-home order may create some confusion with the implementation of the governor's stay-at-home order. And we were actually ready to, some of you know, we were going to have a press conference yesterday at 4:30, and we postponed to today because of the governor's announcement. So I want to emphasize a few things related to the governor's stay-at-home order. First of all, I am thrilled, and we are all thrilled, that the governor has issued his order for the state of North Carolina. But he has made it clear that he respects local ordinances to try to address the specific needs and conditions of their local communities and counties and cities. And his order states, quote, "To the end, nothing herein is intended to limit or prohibit counties and cities in North Carolina from enacting ordinances and issuing state of emergency declarations which impose greater restrictions or prohibitions to the extent authorized under North Carolina law. The Durham City and County order complies with everything that is in the governor's order, but it is more restrictive or descriptive in specific areas. So I want to emphasize that this order takes precedence over the governor's order. And our staff has reviewed the governor's order to make sure that this is the case, and they have confirmed that our city and county-wide order will take precedence. So I ask everyone to please read the county stay-at-home order carefully. And the most important thing is to please use good judgment. There is a FAQ on the city's website that will hopefully answer most questions. This will continue to be updated. We will have a link on the county website to this FAQ, and our staff will be working together to update this over time. And our staff will be working together on further ways to help answer questions about the order. I also want to take this opportunity to really emphasize all of the great things that are happening in our community in the face of this public health crisis and the pandemic that we're all facing. I know that these are difficult, scary, and stressful times for everyone. We are all being impacted by this pandemic. Everybody on our planet. Here in Durham, our city government, our county government, and Durham Public Schools are working hand in hand to address the issues that our community is facing. I am in multiple daily virtual meetings every day with our mayor, Steve Schul, and school board chair, Mike Lee, the city manager, the county manager, the superintendent, all of our city, county, and Durham Public Schools staff are working together every day as actions and decisions are being made to adjust to changing conditions and needs that arise in our community. I cannot emphasize more greatly the amount of collaboration and communication that is happening. It is truly incredible. Our emergency operations staff are working around the clock, led by the amazing Leslie O'Connor, who is our Director of Emergency Operations. Our Public Health Director, Rod Jenkins, and his staff are doing a fantastic job doing the vital work of contact tracing. You know, every time we have, our public health department is contacted about a person under investigation or a positive case, our staff is tracing back all of the possible contacts that that person has had in our community. Our Emergency Operations Center is up and running every day to address critical needs in our community. There is a team working on our homeless residents. There's another team working on food distribution needs, and the needs of the most vulnerable people in our community will always be front and center in Durham County. I want to also say that the response from our Durham community has been incredible. From neighbors helping neighbors through mutual aid efforts that are happening to the next door listservs. There are multiple donor funds for helping our artists, hospitality workers, other displaced workers, DPS families, our seniors, and others needing food. Downtown Durham Incorporated and the Chamber are working hard to support our local businesses. DSS is continuing to serve our community in a remote capacity and make sure that people can get food and nutrition benefits and Medicaid. Durham Public Schools is conducting a Herculean effort, delivering food, information, and learning materials to 67 sites every day. And these efforts are being supplemented by groups like Bull City Schools, Love and Nourish, and Hunger Now, Meals on Wheels, and others. And it is no surprise that people are innovating here in the Bull City. Our local restaurants and food trucks are coming up with new ways to provide their service, and please support them in any way you can. Other groups are finding ways to make plastic shields with 3D printers. People are sewing masks at home. Durham companies are already working on new drugs, test kits, and even ways to build ventilators. People are offering online exercise classes, sharing their gifts as artists and musicians online, and for instance, I'm participating in an online poetry exchange. So I ask everybody to really think about the ways that you personally can find ways to help other people in our community. If you have the resources, donate money. Order things online and deliveries from our local businesses. Call someone who may need help and check on them. Anyone you know in your church, your congregation, to do that. And if you need help, we are here for you. There are so many people in our community that need help. And I want you to know that we are here to help you. Thanks to the passage of the federal aid package approved yesterday, more resources will be coming soon into our community. And we know that the governor and the state has taken actions as well. There are places that you can turn to if you need help. For one of them is a phone number, 211. This hotline is run by the United Way, and people there can connect you to so many resources. Here in Durham, you can call our public health hotline number. That number is 919-653-8150. I want to repeat that again, 919-653-8150 is our Durham County hotline number. You can also email dcovidquestions@gmail.com. Again, dcovid questions@gmail.com. And for help with any social service needs, please call 919-560-8000. So again, I want to emphasize with the Durham County stay-at-home order, the importance of this really being up to all of us and how we really can take control of this situation and the power that we have, each of us individually and as a community and as a state, to help stop the spread of this virus from one person to another so that we do not overwhelm our healthcare system and we can make sure that everyone in our community has the critical care that they need if necessary. DHHS Secretary Mandy Cohen challenged us all yesterday to try to improve our own health by doing things like addressing underlying health conditions. And I want to encourage people, if they have concerns about their underlying health conditions, to please, again, reach out to Lincoln Community Health Center, our Duke Health System, Durham County Public Health. Tell them we have fantastic telemedicine resources to help people. She encouraged people that now's a great time to stop smoking if you're a smoker. She encouraged all of us to get outside every day, to get some exercise, to take a walk. It's a beautiful spring. And for all of us to try to eat as healthy as we can, get enough sleep, and we all need to try to do what we can to support each other and reduce our stress. For families who are struggling to work at home, who have lost their jobs, who are trying to help their children with their schoolwork every day, and even for those who have family members who are worried about their loved ones that are going out to work each day because they need to. Again, we can all take control by practicing social distancing of no more than 6 feet between people, and if there is less than 6 feet, for no more than 10 minutes, and all of the sanitation practices related to washing hands for at least 20 seconds with warm soapy water, cleaning often used surfaces, not shaking hands, coughing or sneezing into a tissue if possible or our elbows, and cleaning anything that is exchanged between each other. So we can still all practice these things. We can do this, Durham. Many of us have already been following a stay-at-home order and guidelines really for the past 2 weeks. And so we can surely do this in earnest for the next 30 days. This is really such a critical time. This is our chance now to slow the spread of this virus, and perhaps doing this and really taking this seriously, every single one of us, that we perhaps can really get control of the spread within this next 30 days. But at the end of the day, it is all about you and me and all of us. This is all about individual responsibility. We need you, everyone in our community, to practice social distancing and proper hygiene. We need every employer, every business, including those who are considered essential and protected, to follow these practices. This will not work without each and every one of us. I also want to note that there are counties like Wake County that are currently not allowing gatherings of any size, and there are countries like Britain that are limiting contact between only 2 people at a time. The governor's order and the Durham County order currently still, it allows gatherings of 10 or less people. But I really want to emphasize that please use common sense. This does not mean that people should actually get together in groups of 10 people or less. We really should really try not to have social gatherings of any type. The ones that I have seen great examples of are what we saw with Carolina Arbors, where neighbors got out in the street at a distance. Things like that are obviously okay, but play dates are really not okay. They are just, you cannot have play dates, and just there really is no cheating with anything like this if it's going to work. So please take this seriously, and if it's not working, I've had conversations with the mayor, and we will confer with our public health director, but we may have to revisit the guidelines related to 10 people or less if it doesn't seem like people are practicing or making safe decisions. I want to also add that I did not give the correct number for the public health hotline, and I have been notified that the correct hotline number for public health is 919-635-8150. Again, 919-635-8150, and I apologize for that. So finally, I want to say that there are, the good news is there are great things happening in Durham County. We are all working together on every level. There are so many things that are within our control and our power. I can't say it any better than what Secretary Cohn said yesterday to our beloved Bull City. We can do this. We are strong. We are in this together. So let's stay home. Let's practice safe sanitation, and let's stay connected, everyone. Thank you. And I know we have some members of the press here. I don't know if there were any follow-up questions that anybody had about anything in the Durham County stay-at-home order. I'll be happy to answer any questions if any of you. Okay, great. So again, we will get this also translated into Spanish as soon as possible up on our website. Maybe, do we have a date by that? As soon as we can, we will get this out. And again, thank you everyone. Thank you everyone in our community who is doing so much to help each other and to help everyone stay healthy and safe in our community.